Elderly AML has been a major challenge for physicians for many decades. The discovery of new therapies to improve clinical outcomes in this population has been an area of great unmet need. Targeting BCL2 has been quite successful in lymphoid malignancies, and so the question was asked whether Venetoclax, a very potent and specific inhibitor of BCL2, could have a role in patients with acute myeloid leukemia. An initial phase 1 study, which was done predominantly in patients with relapsed and refractory AML, found a clinical response rate of about 19%. So a new phase 1-2 multi-centre study was performed combining Venetoclax with low-dose Cytarabine, a treatment which has been used in patients with elderly AML for many decades. Clinical responses to low-dose ROC have historically only been less than 20%, and expected survival durations less than 6 months. In this clinical trial, 61 patients were treated with the combination using Venetoclax at a dose of 600 milligrams a day, with low-dose ROC given a dose of 20 milligrams per metre squared for 10 days each month. The clinical responses showed that among 61 patients treated, that complete remissions could be achieved in 54% of patients, and partial remissions in another 7%, giving an overall response rate of 61%. This is roughly 3 times what has been seen historically with low-dose ROC alone. Furthermore, the clinical responses were observed in quite a diverse range of elderly AML subsets, including patients over the age of 75 who had response rates of 70%, patients with secondary AML who had response rates of 52%, and even patients who had prior exposure to demethylating agents for myelodysplastic syndromes had response rates of 53%. Therefore, we believe that low-dose ROC plus Venetoclax provides a new avenue of therapy to patients with acute myeloid leukemia who are older and potentially unfit for intensive chemotherapy. And this treatment regime is now being taken into a phase 3 randomised study to try and demonstrate improvements in overall survival.